Hi everyone, Dr. Matakata here. I hope you're enjoying the course so far. There's been a lot of material. You're doing great. Hang in there. And there's a lot going on in the world and in life, of course, so do your best. I wanted to give you more information about what's next in our course. And we're also going to skip around now. We've been going in order of chapters in the textbook, but now we're going to kind of shift things around a bit. And I want to make sure that you're clearly aware of that. So this week's module, you're focusing on personality. I've already introduced you to personality disorders, which we'll talk more about when we get to the chapter of psychological disorders. And also I want to have more conversation about personality disorders and what it means to pathologize someone's personality. What does it mean to say that you have a disordered personality, and some of the challenges and controversies around that. Anyways, next step. For the next module, we'll focus on chapter 14, highly relevant during this time, stress, lifestyle, and health. We'll talk about the different forms of stress and stressors and how it can impact a person's health and well-being. And then after that module, we'll go to chapter 15, which is psychological disorders. We'll talk about the more common psychological disorders that are seen in the field of clinical psychology. I focus more on this because, well, my background is clinical psychology. I practice as a clinical psychologist and do research in behavioral health and behavioral medicine. And so I think also when students take this course, they're very interested in, one of the questions I hear most often is, why do people do what they do? Or why are people this way? Or why do certain people behave this way? And so let's focus on that. And we'll talk about psychological disorders and variations of that, and what does it mean to diagnose and classify psychological disorders, and having a common language for clinicians and researchers so that we can discuss and treat psychological disorders, even though people don't always present with the symptoms in a nice, perfect, way of like, checklist, check this symptom off, this symptom done. You have generalized anxiety disorder. And it's not always that clear cut, but we have this system to help us communicate, talk, research, and treat people. So we'll focus on that, and then we'll spend probably 2 weeks on psychological disorders because there's a lot, and I want to make sure that you really understand and appreciate this area of psychology. Then we'll go over therapy and treatments for the different psychological disorders. I'll provide you with some film or video clips, some of the better ones, I think, that do a good job at showing what someone with a particular psychological disorder looks like, or the struggles that they endure. And then, of course, some additional readings. After that, we'll spend time on therapy and treatment. I'll introduce you to that, how the field addresses psychological disorders. And then if there's time, we'll go back and look at social psychology and industrial and organizational psychology. We don't focus a whole lot on social psychology and IO psychology because those are full semester courses. You can take social psychology classes here at PCC or elsewhere when you transfer. Similarly, again, remember, this is just an introductory course. There are full year courses on research methods in psychological science, biopsych, lifespan and human development. So it's just scratching the surface, but hopefully you'll find the next few weeks of this course interesting, because we're going to really talk about the nitty-gritty, the psychological disorders. If you have any questions, again, please feel free to send me a message in Canvas inbox. Times are really odd right now. We're in an election year. There's just a lot going on in life. I understand. Please keep in touch with me if you have any challenges or issues that I should consider. I'm flexible with the deadlines as long as you get the assignments in. Please communicate with me through Canvas inbox, and I will do whatever I can to support you. I hope you're doing well. Take care. Bye-bye.